And were there any big takeaways that you wanted to share from your Masters of Science in Public Health program?
Mm, Definitely, build relationships with the people in your program and your professors. In general, that's just a very important lesson you should be aware of, that you want to help people, they'll be able to give back to you as well in the future, but you definitely want to invest in relationships. That applies in school and your career and at any point in life.
Absolutely agree with that. And after you graduated, you got into the Applied Public Health Informatics Fellowship at the County of San Diego. So tell us about that experience.
Yeah, so that was a wonderful experience. I had I had so many supportive people around me. There was not just my two official mentors, but there were several others that were basically informal mentors, and just equally helpful. And they saw somebody that's doing a fellowship. They're there to learn, and they were just more than willing to provide words of encouragement, teach, correct, gently, and just provide a lot of exposure, or even like at the senior levels, providing um, transparency, visibility into some of the things that are going on. A government is huge, and so uh, understanding the dynamics of what's going on, how all these things play into this very massive project. There was a very massive project going on at the time that was like a decade ahead of its time, and it was about integrating public health, social services, and various other agencies, a lot of that data together, so that they can do more continuity of care. If someone comes in sick, homeless person or something, they can get referred to public health if they need some testing, to social services if they need greater support. And so that was happening back in 2013, and in my opinion, it went pretty quickly, and I got exposed to a lot of very, very neat projects there, a lot of cool work, very advanced. Thinking about from a business perspective, I got to work with a team that was very business oriented. Also, like one of my mentors was a technology leader in the county, and yeah, and of course my mentors were public health leaders in the county as well. And so it was just a lot of visibility and training, and being able to think from like a sort of panoramic perspective of everything that's going on in an agency, how it works the way it does, how to make improvements. And a lot of it, as a probably because of the projects that I was assigned with, but just because of the fellowship. But yeah, a lot of it they showed how much information systems are underpinning a lot of this work.
It sounds like an awesome experience,
Yeah.
coming out to your master's program and really getting to dig in there. And seems like you also had like a lot of guided mentorship that also supported
Yes.
in your professional development, which I think is really, really important as you're coming out of any program, because it's your first foray into maybe like a 9 to 5 type of role in a professional setting many times.
Yeah.
And
I
after,
Yeah, go ahead.
no, you go ahead.
I was just going to add more about AFIF. So yeah, just adding about how supportive they were. I mean, my mentor would say, we just want to make you happy, right? Whenever we discuss, what I'm going to do, whatever, we just want to make sure you're happy, and they really showed it with their actions. And the other opportunity I had there, it was one day, one of my mentors tells me, "Hey, there's going to be this BioSense 2.0 meeting." And it's basically a network of people doing syndromic surveillance. That's what his team specialized in. And there's going to be a meeting. Maybe you want to jump on it. And so I jump on, and I'm hearing, this is my first exposure to a community of practice. I start hearing, there's a lot of people in these discussions. There's like a vendor, the CDC vendor for the system. There's CDC. There's, at the time, ISDS was this, International Society for Disease Surveillance, and all the stilts that are participating in this, the state, territorial, local, and tribe jurisdictions participating in this program. And I'm hearing this, the dynamics of the conversation. Essentially, the epidemiologists, the stilt epidemiologists, are saying, hey, like we're not sure about the quality of this data, and there's not really any tools available within the system for that. And that's something that they're trying to raise, and I'm sure that on the other side it's trying to be addressed. But as I heard about this, oh yeah, the other issue was that their system, one of the systems within this platform was our Studio Server, so that was within this Biosys 2.0 system. And the EPIs at this time, 10 years ago, did not really know R. Their R was not popular back then. It was SAS. I would say it was 99% SAS back then. And now maybe that has decreased to this, I guess, depending on who you're including, but I would say half, like maybe more 60 or 70% SAS, but there's many, many more R users now. And so essentially these stilled epis, which only know SAS, were given in the R system, R to use. And they're like, well, we don't know how to interact with this thing. So, we can't, it's not very useful, right? And so I knew R. And so I voiced, hey, I could write these scripts, these code scripts that'll do such and such and calculate those things. I think I voiced it, and then I put together a plan, like I created a PDF document that said, first we would need to do this. Well, here's the purpose of this project. Here's the problems. It would do this, this, this. It really helped that I had gone in the AFIF program. There was a lot of training from the sponsoring organizations. One of them was the Public Health Informatics Institute, very well known in public health informatics. And I had received training about project management in that. And that was possibly the most important skill that I learned during that year from those trainings, because that is what working with all these people from different states, that's basically what I had to leverage the most. And so I put together what was almost like a project charter. And so I proposed it, and people really liked the vision there. And then I started actually carrying out the project management way of doing things, like with a legit project charter. People need to get it approved. Project requirements gathering, prioritization, meeting with people, being like, okay, we need to make sure we can't do everything, right? We need to prioritize things. So there was a lot in that process, and getting things validated because it's technology tools. And so I carried out this whole basically software development lifecycle during that year. And I did that with, I think there were at least 5 other jurisdictions supporting. And I basically had another mentor in one of the people that was helping with this project, guiding me about how the environment and what people need, just like voicing it, because people are very busy. If I say, can you fill out a survey, they can't always do that, right? Or they don't always have the time to contribute writing anything, right? Contributing to the code, they may not have that time. And so she Atar Bear was extremely helpful, was a mentor, extremely encouraging, and guiding me through what I should be doing, or just really, she wasn't really telling me like do this or that, but just guiding me and being supportive, like, yes, that providing validation of what I think needs to be done, and that I'm not wasting my time, that I should be continue doing these things. And so that was, again, that was all within that County of San Diego experience. And it was cool because it widened my network. I got to work with really, really incredible EPIs, very experienced. Some started their own consulting companies, but they were throughout the whole country. And my lesson there is that that I've seen there and from other things past is that really it's the followers that make the leader, right? Like, you don't just go like, oh, I'm gonna be a leader and do all this stuff.